Ciao mondo, hello world, hola mundo, hello monde, konnichiwa, ni hao, namaste. Dear friends, we are in Rome and we are at the Consensus Conference on hemoadsorption hemodialysis for chronic dialysis patients. This is a consensus conference that has been created by the International Renal Research Institute of Vicenza, and it is endorsed by all major scientific nephrological societies, including ERA, including International Society of Nephrology, and many national nephrology societies from Europe, Asia, and Latin America. We had the opportunity to be supported by unrestricted grants from different companies. Approximately 10 sponsors are supporting the conference. And we have invited experts from all over the world to join and participate in a classic Delphi modified structure where we did some pre-conference reading of literature and data collection. In the conference, we're doing plenary sessions and breakout groups where questions and resolution and statements are identified. And the post-conference activity will be mostly devoted to writing a manuscript that should report the resolutions of this conference. We have experts from India, Indonesia, China, Philippines, and then Latin America, Brazil, and Argentina, Chile. And then we have from Europe, Greece, Belgium, Spain, Germany, France, Italy, etc., etc. So the important contribution of each of the experts will be to try to promote a standardization of the application of this new therapy. The rationale for application is in the fact that we still have a percent of patients that are suffering from specific signs and symptoms of uremic intoxication that are not corrected even by the best dialysis therapies that we have available today. In this patient, the addition of adsorption may contribute to remove the retention molecules that are responsible for inflammation, cardiovascular events, and other symptoms such as restless leg syndrome, sleep disorders, inflammation, muscular weakness, loss of appetite, etc., etc. But of course, if we compare what has been done for hemodiafiltration, we have seen that it took approximately 50 years to get the therapy established and now use it as a standard of therapy. We don't want to waste another 50 years to get this therapy considered a good golden standard. So the idea is to promote and stimulate a recommendation for the indications, for the application and prescription, and for the monitoring of the therapy in a way that we can also collect real-world data and homogeneous data sets that may allow us to draw conclusions even in the absence of the desired but difficult to do randomized control trials. The scope of this conference is exactly this, and it is so important that we achieve consensus on the recommendation on how to do it, in which patient to do it, and what to monitor, that at the end of the story, probably in 1 or 2 years, we can collect enough data to provide the scientific community with the necessary evidence that is always required to apply new therapies. The endorsement by the scientific societies is a guarantee of the interest. The endorsement and support by the companies is also a very important aspect to consider, and the International Renal Research Institute of Vicenza is very proud to host this conference. With this, thank you very much for joining today, Cappuccino from Rome, Italy. Excellent.